Good afternoon to you all. My name is Dr. Yvonne, resident doctor in pediatrics, first year. So as you've heard, the patient will be making 3 months this week on our ward. So I've decided to arrange the presentation in such a way that we have phases. So phase 1 on 16C, phase 2 in PICU, phase 3 back to 16C where he's still with us. Yeah, so for treatment, so for the first phase, 16C, 14th of December to 17th of January. Treatment, we had IV ceftriaxone, but we added IV flucamox for the osteomyelitis. Then he continued tabs ibuprofen for the pain and his anti-failure regimen, which was carvedilol, Lasix, enalapril, and spironolactone. Then for the investigations done, later we shall see the results. And consultations, we made a cardiologist consult who came on the 18th of December, that's 5 days later. Then a pediatric surgeon, and then physiotherapy because the child was immobile. So CBC for 2 different days measurements. We had a white cell count, total white cell count, which was normal. Neutrophils slightly high. Then lymphocytes normal. Then we had a raised RBC count, HB, HCT, and a normal PLT. So the ESR was that which was normal. We had a very high CRP of 320 milligrams per DL. Probably this is what prompted the admitting doctor to start this patient on antibiotics, considering they didn't have a fever. Then the hip X-ray was done, but of poor quality, we couldn't really tell much from it. Then the ultrasound scan of the hip. So when the surgeons came, they suggested an ultrasound scan of the hip because there was a painful gluteal mass. So this is what it showed, an echo-complex, predominantly cystic mass in the right gluteal area, measuring that. And then they suggested an ultrasound-guided biopsy, aspiration of that. And the pus which was taken off, the culture, they identified Citrobacter frewundi, isolated, which was sensitive to chloramphenicol, but resistant to amikacin, ceftriaxone, imipenem. Yeah, so then at that time we started the child on IV chloramphenicol. Then I've tried to extract the significant findings in the 3 months so that we can be able to follow it. So on the 17th of January, this is when we had a turn of events. The mother reported left-sided body weakness, a slurred speech, respiratory distress, and at that time the child was in respiratory distress with transmitted chest sounds. And the plan was to do a brain CT scan, thinking of a thromboembolic stroke, to do a cardiac echo. IV metronidazole was added, and then the child was transferred to PICU, and then put on CPAP. So our second phase, we have 17th of January to 30th of January in PICU. And these 2 were the working diagnoses. Then while in PICU, this was 3 days later, the examining doctor noticed that the child now had left hip pressure sore and also sores over the wrist, but also had a swollen left limb and it was tender to touch. And then they thought of DVT. So investigations asked for, there was a CBC, then a Doppler ultrasound scan of the left limb, which showed a left external iliac vein deep venous thrombosis. So management in PICU, we have chest physiotherapy. Remember the child had aspiration pneumonia. We had physiotherapy of the limbs which they had started was put on hold. Then the child was started on low molecular weight heparin at 20 units BD, and then warfarin at 5 milligrams OD. Then the previous management was continued. So later when the child improved, had more movement in the left side of the body, and the aspiration pneumonia had resolved, the child was sent back to 16C. However, we noted during the time they were in PICU, no INR tests were done. Yeah? So the first test we did on the 30th of Jan had a raised INR of greater than 120. The subsequent as well, the 4th of February. Then 6th of February, still above 65. Then 8th of February, above 55. And at this point, the child bled from the gluteal abscess he already had. So we stopped the low molecular weight heparin and the warfarin, and was transfused and also given iron vitamin K. But then on the 15th of February, when the INR dropped, and remember this is a tough patient, we decided to restart the low molecular weight heparin. So the new events on 16C, we had multiple bed sores, sores, then gangrenous left toes, then also an abscess over the right hip. So the plan was daily wound dressing with metronidazole, to do a pelvic x-ray, and then also consult the surgeons. And also at this point, we repeated the pus swab because now we're having multiple sores, the child is getting worse. So the repeat pus swab culture still shows Citrobacter frewundi with gram-positive cocci and gram-negative rods. And then the result which came out from microbiology only gave us resistance, it didn't give us sensitivity. So when we went back to consult, the conclusion was let's try amikacin and meropenem, which the child is currently receiving. Then a repeat Doppler ultrasound scan was done, and this time we have thrombosin in the lumen of the common femoral vein and the entire length of the femoral vein. Then pelvic x-ray confirmed osteomyelitis. So other consultations we did was nutritionist. From the start, they had tried to give the child F75 and Rutafa, but he always had loose stools after taking it. So like for 2 months, the mother was giving the feeds she could buy. But then the child was losing weight. Yeah? So he dropped from 20 kilograms to 18 kilograms. So the nutritionist came in and they tried Rutafa, but still it failed this week. And when she came today, she thought she can start the child on soya porridge today. Then we had ped surgical and orthopedic consult, because we were thinking, what's the best thing for this child? Most of what we are managing is surgical. Is he best managed on a ward or a ped surgical ward? But there was no conclusion. Yeah. And when the orthopedic team came in, with the osteomyelitis, they thought there's nothing much they can do because of the condition of the patient, but they could try disarticulating the gangrenous toes. So that's the first and second toe of the left foot are gangrenous. Then we also called in the palliative care team for pain management. The child is currently on morphine. Then also a social worker, because with time, I don't know if you noticed that some tests were not really done, the cardiac echo, the brain CT scan, because of the financial constraints. So, So where we are currently, we're waiting for an INR we did yesterday. The child is still bedridden. We're on IV meropenem amikacin. And
okay,